Martin, in one of your books, Open Innovation 2.0, you stress collaboration. So how has working across tech and clinicians and patients accelerated change?
Yeah, great. And there's kind of a hierarchy.
Yeah.
And actually almost at the bottom level is competition. Everybody values the free market and competition,
Yeah.
but there's a much more powerful and much more impactful sort of construct, and you could arguably call it co-opetition, where we're both competing and collaborating together. And Open Innovation 2.0 is a paradigm, but also a methodology for structurally changing industries using digital technology. And that's exactly what we need. In Open Innovation 2.0, we have a number of what we call core design patterns. You need a platform, you need to orchestrate the ecosystem, you need to industrialize the innovation process. But at the highest level, it's really simple. We talk about high trust, high capability relationships, hopefully the kind of relationship we've established over a couple of years.
Yeah.
We talk about intensive networking. We talk about a shared vision, and we've set stay left, shift left, 10x as a journey travel, and then using digital technology. And by putting that all together, we hope everybody's innovating in the same direction. In fact, they're co-innovating, and the outcome is what we call the 3 W's: shared welfare, shared well-being, and shared wealth. So innovation is all about creating the future. And President Obama, he talked about a great quote. He said, innovation doesn't just change our lives, it's how we make a living. In the book, I talk about the 5 P's, purpose, progress, people, passion, and then profit. And you have to do the first 4 first before you get the profit. And profit is very important. And, Peter Drucker used to say, profit is not a cause, it's an outcome. But by co-innovating together, we actually can make a lot more progress. And there's a very important concept called emergence that I use a lot. I'm inspired by a guy in London, Joss Colchester, who's doing a lot of work on this. But Ilya Prigogine, he has a beautiful quote. He was a Belgian-Russian Nobel Prize winner. And he said, when a system is far from equilibrium, small islands of cohesion have the ability to transform the whole system. So we use a principle of guided emergence, and we actually have an open collaborative ecosystem where many people come together that have high trust and high capability. They interact very closely together, and we get this guided emergence coming in. What that is, first we have this shared vision. So we actually call it Mission 10X, is the mission to build a 10 times better health system. But then the collaborative and co-innovative interactions between the parties, they work together, and we're slowly building towards this new vision. And what we get, almost spontaneously, is a phased transition to a much higher order system. So think of the transition of water to steam. That's the kind of transition we're going to go through. So what I've been busy doing, and I see lots of evidence of you doing that here, are these innovations that at a certain point we're going to have critical mass, and all of a sudden this new system is going to emerge, and that's the hope. So we'll move from the caterpillar that we can't keep fattening to this new kind of health system where actually people are a core part of it, and they're empowered through their mobile phone, and they're much better educated. Everybody should know their blood pressure. Like my watch, I bought this watch. Also, which device is that? Yes, and that's a good device. Actually, the reason I moved from a Fitbit, I'm not endorsing a product, to the Galaxy 7 because it does my blood pressure. I can do my ECG. It does my oxygen saturation level.
iPhone 17 came out last night, and that has the same.
I saw that, and they're awaiting FDA approval, and that's very promising. So we actually had this Cambrian explosion, and it's a really unique point. It's really exciting, but I think if there's one thing we could do, it is, basic health and literacy for everybody. We all go to school and learn language, we learn maths, but we know more about our car's health, and in fact, we'll get a proactive warning. And what we need to be able to do is through, and this is called the quantified self, for the Internet of medical things. I was just talking to your nurse practitioner here that works with the diabetes patients, and I think that's a brilliant example of stay left, shift left 10x at work. So Sir was telling me some of the patients wear the, either a Libra or Dexcom continuous screw,
Yeah.
and she says she wears them. I actually wear them occasionally, and it's great. We can see in real time what's happening with our blood sugars, and it changes our behaviors. I know when I need to walk or I shouldn't have had that cream cake. But Sarah was telling me, she'll routinely look at the, each of the patients. They give their consent to share their continuous glucose monitoring score with her, and she can go in and look, and then she can actually go to the patients. You might have to titrate in your medicine, or even just a word of encouragement, because it's amazing what positive reinforcement can do. Melanie, you're doing really well, and that's a brilliant example of stay left, shift left 10x and using the power of digital. And these patients are empowered as well because they've chosen to wear these devices, and it's informing their behavior.
Yeah.
Absolutely.
And if we could save one diabetic foot, amputation, which is horrific, and this can be the progression of, unmanaged diabetes too. It's horrific for the patient. It's extremely costly, for the health system, and has massive consequences for quality of life. And we actually know now how to manage and reverse diabetes too. And, if that's all we did, that would make a huge difference. Yeah.